From KPRC, you're watching Local 2 News at 5.
A Houston doctor is going far beyond the state of Texas to save lives. His passion for helping others takes him half a world away, in fact, to Kenya.
Elizabeth Scarborough introduces us to a man who's giving us a whole new view of medicine and how it can change lives.
Are they going to remove the breathing tube today?
For Dr. Sean Boutros, being in a hospital is no big deal.
This is one of our first patients.
He usually works out of Houston's Memorial Hermann Hospital and has his own plastic surgery practice in the medical center. But working at Kenyatta Hospital in Nairobi, Kenya is different. He's here with a purpose, to teach local doctors complex surgeries they've never done before.
It is not the 10 children that I can help in a week. It's the 10,000 that I can help over the course of the lifetime of all the doctors that we're training and teaching.
The cases he's doing change lives. The people he works on are having ears reconstructed, legs rebuilt, facial deformities fixed, mostly from the poorest population in Kenya.
Those type of services are not available there. So if those services aren't available, they simply would have no option.
Dr. Boutros showed us firsthand, taking a camera with him on his week-long journey. And that's why he came here, to help through his charity called the Houston Foundation for Facial Reconstruction. Donors pay expenses and buy equipment.
If you add all the surgeries we did together, to get all those surgeries done in the United States would have been easily, between hospital fees and x-rays and all those things, it would have been probably about $1 million.
But these patients are getting life-altering procedures for free.
So the surgery will probably take about 10 to 12 hours.
For example, this 7-year-old little girl.
Basically, this girl's eyes are spread too far apart because she has a rare type of facial cleft where the brain comes down between the nose.
It's not just that she doesn't look normal. It can lead to infection in the brain that could be fatal.
And we take this central piece of bone and we remove it.
A risky surgery, but in the end, it went well. The 9 others were successful, too, in so many ways.
There's no way they would ever be able to get those procedures done.
Doctors get to learn skills to pass on and improve other lives.
We have had a wonderful time with Dr. Boutros. We have learned some complex craniofacial surgery.
But Dr. Boutros says the reward is really his.
You feel very fortunate for what you have and for your life. And what it does is it teaches you a lot of lessons about what matters and what really doesn't matter.
You know, with 2 more trips to that hospital in Nairobi, Dr. Boutros hopes to have taught the local doctors enough so that he can then move on and find a new hospital to help.
Now, if you'd like to find out more about Dr. Boutros' foundation, you can find it on our website. Look under the hot button on click2houston.com.